So we're here with Ileana, who has knee pain on her left knee, and it's a bit swollen. About 2 weeks ago, we did some local treatment with the laser and the COSMODIC, and she had good relief for a day or two, but the pain came back. And then 2 days ago, we did it again, but we didn't get much of a result because she still has pain. Her range of motion is pretty limited. She can only raise her knee about that much. So today we're going to try and work with the trigger points, and her pattern of pain goes from about the hip all the way down the thigh and into the lateral portion of the knee, which is a little bit swollen. And we are going to start with the dove.
Usually the first thing I do is show the patient the book with the pictures of the different pain distribution patterns, and then let them pick out the one that they think is the best match for the area where they're currently experiencing their pain. Then we can look for the actual trigger points, which are the areas in the muscle that actually cause the pain. Now I'm going to hunt for these points. Usually trigger points can be quite sore, and also depending upon the size of the muscle, you sometimes have to push really deep to find them. But the patient will definitely let you know when you find them. Sometimes they'll actually jump. Although I didn't do it here, it can be helpful to mark the spot once you find it with a Sharpie pen, especially if you're going to be doing treatment in multiple days. It just makes it easier to locate the point the next time so you don't have to hunt for them again. When dealing with pain, I really like the dove. For some reason, the SCENAR signal it puts out seems to lock onto the pain signal and allows the nervous system to really deal with the problem effectively. Since Ileana is used to the modifique, I explain we want to really feel the current. Not painful, but to really feel it. There you go. Whenever you get that reaction, you know you need to back off a little bit, and the patient understands. So now we're going to treat each trigger point with a dove and let each point fully dose. For the purposes of this video, I'm just going to treat one point. There we go, it's dosed. Here I'm using the 808 probe of the Q laser to work the trigger points and the painful areas as well. The combination of SCENAR and 808 probe tend to work very effectively and synergistically because they have different modes of action. By the way, acupuncture needles and the sore trigger points also work well. And another advantage of the 808 probe is that it works very fast. Usually all you need is a minute or two on each point, but you can go the entire 3.5 minute cycle if you feel you need it. Auriculotherapy is a very exciting way of treating many conditions besides pain, and the 660 probe of the Q laser is really a wonderful tool for it. Interestingly enough, the entire body is fully represented in the ear. Here I am treating the knee point in the ear, and I like to apply the laser for 2 minutes on each point. Now we stimulate the thalamus point, where pain is perceived in the brain. Using this point alone is very effective to help with any painful condition, no matter where it is in the body. Interestingly, this point also reduces swelling and is very good to use in cases of shock. So now I ask Ileana how she's doing, and she says that she's happy because she doesn't feel the pain like she did at the beginning. That she just feels a little bit of tension, like a tight feeling there. And and that she's happy because now she can move her leg back where she couldn't do that before. And she just feels a little bit of pain in that one area, that little triangle. And then she moves quite too much, and she says she's happy because she couldn't do that before. So she also said she had about an 80% to an 85% reduction in the pain. And I think that's a pretty good result.